Welcome back. If you're worried that your child may suffer from scoliosis but you don't know how to recognize it, well, take a listen. Here is Dr. Kenneth Jeffers, pediatric orthopedic surgeon. Dr. Jeffers, good to see you, my friend. Welcome to our show.
Thanks for having me, Dave.
It's our pleasure to have you. Scoliosis. So I think we all remember, touching our toes when we were kids doing the scoliosis test. From a medical standpoint, what is scoliosis?
Well, Dave, the definition of scoliosis is any sideways curvature of the spine measured at more than 10 degrees.
And how serious is it if a child comes to you and you diagnose them with scoliosis? Oftentimes, do you need to correct it? Is it something you monitor? Are there different levels of it?
Well, there certainly are different levels of it. Scoliosis can be minimal. The majority of them are minimal. But occasionally it can become quite severe. Mm-hmm. Most of the severity has to do with this cosmetic impact, of course. Scoliosis is not life-threatening.
Right, right. Is it, does it happen in the womb? How does it happen to people?
We don't know the answer to that question.
Okay.
We think that the most common type of scoliosis, the idiopathic type of scoliosis, has some genetic basis. You are born with a risk of having scoliosis. The degree or extent of that risk, we don't completely understand. That's a big area of research in orthopedic surgery.
Do we know who is at risk for it? Who might be at more of a risk for scoliosis?
At present time, we do not. We know that girls get it more often than boys.
Interesting.
So female sex is a risk factor, but we think that there are some inheritance patterns associated with scoliosis.
So, we've sort of already explained this, but so how is it caused? Like specifically physically, what is happening in the body?
Difficult question again to answer.
Right.
One way of thinking about scoliosis is to think about it as crooked teeth. We don't completely understand what causes crooked teeth, do we? And crooked teeth can be minimal and severe. And we think that it has something to do with the structure of the bones. And in the case of the spine, we think that there's an impact of muscular involvement and ligamentous involvement. We don't completely know all of the answers to those questions that you're asking.
So if a parent brings a child to you, how do you test for it? What do you do?
Well, the test is quite simple at this time. It's called a forward bend test. And the forward bend test is an area of some controversy. However, it certainly is the best that we have. It basically involves having a child bend forward, and the observer evaluates the geometry of the most prominent parts of the spine.
Okay. I know we already established that there are different stages of it. How painful is it? How painful can it be?
Well, scoliosis does not typically present with pain. Intuitively, of course, one can suggest that any deviation from perfect anatomy can result in some discomfort. The presentation isn't often pain. Mm-hmm. So a patient who has scoliosis and pain needs to be looked at quite closely.
And you had mentioned this, it's really, I guess, in many ways more of a cosmetic problem than
it usually is, Dave. It
right.
usually is a cosmetic issue, never an emergency. And typically its presentation to the medical community comes from an appearance.
Right. So what are the treatments? What do you do?
Well, again, as with everything, it depends on the degree of severity. Minimal curve needs nothing, and most curves are minimal. Certainly a severe curve can have some impact both from a psychological perspective, but certainly we think that into adult life, there may be some impact as far as degeneration of the joints and so forth. So the treatment in most cases is observation. Moderate curves require a brace, and the concept behind the brace is in a growing individual, the brace holds the curve at a certain degree of crookedness, if you will, until growth is completed. The more severe curves, of course, which are the minimal, require surgical intervention.
Without getting too medical and technical, what is entailed in the surgery? What does it involve?
Well, I like to think of it, as I hinted earlier, like crooked teeth.
Right.
The treatment for crooked teeth involves placing a brace on every deformed tooth, placing a wire and pulling the wire, and the wire straightens the teeth. That's a very, in my mind, a close analogy to the treatment of scoliosis.
But you're not going in. You're not cutting someone's back open and going in and working on the spine?
You absolutely are.
You are? Okay, so it's not just putting the brace around them.
Well, in the case of a brace, it's putting a brace on the outside.
Gotcha.
In the case of surgical intervention, the braces have to be put on the teeth.
Right.
In our case, on each crooked vertebra.
Oof. If it's not severe, if it's moderate and the treatment is observation, is there anything that a patient can do, stretching, sports, anything like that to maybe get it to correct on its own?
Well, Dave, since we don't know what causes scoliosis, we don't know what to do to fix it other than surgery or bracing. Certainly it is best to have a healthy, strong body, so we encourage patients with scoliosis to be as active as possible. But other than bracing and surgery, no other treatments exist at this point in time.
So for parents with babies, before they come see you, is there any, so how do they test at home to see if maybe their child might have scoliosis?
Well, I mean, it's fairly simple, Dave. Scoliosis of any significance, any treatable significance, will appear as a cosmetic deformity. The child that bends forward, it's called a bend test, and while it has some controversy when you're speaking to statisticians and so forth, it has some significance in allowing the parents to identify, oh, there's something wrong with my child's spine.
Right. It's fairly obvious? I mean, no, again, I know we've established there's degrees of it.
Correct.
But it can be fairly obvious.
At the point when it needs to be treated, it's fairly obvious.
Okay, so if a parent sees that their child, believes that their child might have scoliosis, they want to come see you, great. How do they find you? Where are you?
Well, my office is located at West Boca Medical Center. You can find me on the internet from tennetfloridaphysicians.com. That's the web page. You can also call me at 561-394-8443.
And I want you to know that I have, for the past 8 minutes, been trying really hard to sit up straight and have perfect posture for you. So I hope you appreciate that.
Excellent. You're well on your way.
Now I'm just going to go back to this. Good to see you, Dr. Jeffers.
Pleasure.
Come back
Thank you
soon.
for having me.
You got it.